Thank you for visiting the manufacturing and engineering facility of RxAir Industries. My name is John. I am the General Manager for this location. Today we're going to demonstrate how HEPA air purifiers are used to assist hospital infection prevention and control departments. To that end, I'm going to demonstrate the changing particles in this room with the air purifier running. I'm just going to set the particle counter going now while we have a little bit of discussion on what we're about to do. Well, at this facility we manufacture the RxAir 3000. It's a portable air purifier, and it's a Class 2 medical device. And to that end, the quality system here is monitored by the FDA to ensure strict compliance of manufacturing medical grade products. Now, we'll just take a look at the particle counter and how it's doing. And I'll move it a little bit closer to the camera so you can see better as it reaches its final reading. You see there it read 110,000, nearly 111,000 particles. Okay, we'll switch that off. What we'll do now is we're going to switch on the air purifier, and we'll take a reading in a short while after see how the HEPA filtration has changed the particle level in this room. Well, let's talk a little bit about how HEPA air filtration assists in infection prevention in the control areas. It is well known that airborne infection particles can travel on minute particles in the air. They can travel great distances, which is the true meaning of an airborne infection. So it makes a lot of sense that if we can reduce the amount of particles in the air, there are obviously less infectious particles because they've been removed by the HEPA filtration. But there's also less particles of dirt, moisture in the air, so there's less opportunity for any remaining viruses or bacteria to travel in the air and pass infections from one person to another, or from one room to another, or to any other part of the hospital, you know, a corridor where visitors could be passing, a nurse's cafeteria. You know, you don't want any of those. You don't want cross-contamination going into any of those areas. So, what is understood by, or what is recommended by one of the main bodies regarding health is the Centers for Disease Control, is that if you have a patient with an airborne infection, that if you could use HEPA filtration in that room and have 12 air changes an hour in that room, then you're producing a room that's not going to allow much in the way of particles to escape from that room. It's also a recommendation by the Joint Commission, who look to certify hospitals, and so it's a good basis for producing an infection isolation room. Now, the particle counter that we use here is a MET1, and it measures all particles larger than 0.3 microns. Now, looks like we've had a couple of minutes there, so we'll do another particle count now and see how the particles are reducing. You can notice the airflow by the pretty streamers that we have. These are not supplied with the machine, so they would obviously have to be an optional extra if you require streamers. Now let's have a look, see how the reading's going this time after a short while with the air purifier running. You can see the rate of the particle count has definitely slowed down now. And what we're seeing now is around 20,000 particles. You can see that's quite a substantial reduction over over this short time period we've been looking at this. Now we'll just take one more reading before we close down this demonstration, but I think you can already see how successful in a short time period this has been. I would just say we're not going to sit here for 15 minutes, but after about 15 minutes in this room, what you would see is a particle reading of 4,000 particles, and it will continue to decline probably until it reaches about 2,000 particles, and it's not going to get much lower than that because of the natural ventilation. In a room like this, you see the room has got a suspended ceiling. There's a lot of leakage in this room, so it has a natural ventilation that brings that's receiving particles from other areas of this office space. So we'll let the clock get to the top, and we'll run the particle counter again, and let you see how things are proceeding now. Okay, it's the same clock, same beautiful streamers, and same ugly mug you got to look at for about a minute. But then we'll be done with this part of the demonstration, and afterwards I'll come back and show you some figures of how the machine will perform over a longer period of time. But this demonstration should be enough for you to get the ideas of how air purification such as this RxAir 3000 HEPA purifier help infection control professionals. Go have a look, see how the particle count is doing now. You see it's just completed, and now we're at 7,000 particles, and it will continue to go down as the machine continues to run. I will take those readings for you. I'll take those readings and I'll show you them in a chart form shortly. Okay, thanks a lot. I'll be back.
This chart was produced from the particle readings that we took today. You can see that the reading we took on camera after 3 minutes showed an 82% reduction in particles, and after 8.5 minutes the reading we took on camera showed a reduction from the original reading of 93%. Later I took another reading at 15 minutes of 3,410 particles, showing a total reduction of 97% from the original reading. This chart was produced from the readings we took today, demonstrating how extremely effective RxAir HEPA air purification is at reducing room particles, and therefore reducing the opportunity for airborne infections to spread from person to person and room to room. If you'd like to discuss the testing that we did today in more detail, just give me a shout at 1-800-231-3248. I'll be pleased to talk to you. Bye for now. Take care.